When you hear about the Affordable Care Act, Obamacare, and I don't mind the name because I really do care. That's why we passed it. We passed Obamacare. Yeah, I like the term. We passed it because I do care.
And I tell you, 5 years from now, when everybody's saying, man, I'm sure glad we got health care, there are going to be a whole bunch of people who don't call it Obamacare anymore because they don't want me to get the credit.
Optics and verbiage. Two things that make up more American opinions on key issues than the facts themselves sometimes. The optics side of things we've seen many times over in the Obama administration recently, often to the fail level. And now we have simple words when it comes to a contentious national issue. It's all about using health care in place of Obamacare. And apparently some Americans are just fine with the idea as long as the president's name is not attached to it. Welcome to MidPoint. The chairman of 60 Plus Association, former member of President George W. Bush's Health and Human Services transition team, Jim Martin, and a professor of economics at MIT who is also one of the major architects of the Affordable Care Act, Jonathan Gruber. Gentlemen, thank you so much for being here today.
Good to be here.
Good to be here.
Jim, let me begin with you on this one, if you will, because as we look at the different studies that are out here right now, it tells us that Americans are not that upset about it as long as it's not Obamacare. Here we go. This is a poll from Morning Consult. The question is, do you think all states should expand Medicaid as encouraged under the Affordable Care Act? When you use ACA, sure, people think it's wonderful. However, when you use the word Obamacare, it's not quite as approving, if you will. What does that tell us then about the way this is being presented and about people's general perceptions of this health care?
Well, words are powerful, of course. And again, Obamacare, I love to use the president's words. He said, man, that's what we want to call it. I'm proud of that. But now, quite frankly, this is the biggest government entitlement in the history of this country. But why is it those Democrats who voted for it never mention it on the campaign trail anymore? It's quite simple. They promised more care at less cost. What they got was less care at more cost. Senior citizens have long memories. They will remember that when they go to the polls in November. The Senate, quite frankly, is going to switch in November, primarily because of Obamacare being rammed down their throats.
Jonathan, let me get to you then, because certainly on this whole thing starts immediately with perception, Obamacare versus Affordable Health Care Act, or certainly just saying health care here. What does it say to you when people, if they're hit with the exact same plan, they say, oh, it's not a bad idea. You say Obamacare, and all of a sudden the hackles go up and everything stops.
What it says to me is this is a debate which has been poisoned really by the kind of misinformation, quite frankly, the other guest has just laid out. People like to lay out extremes that are simply not borne out by the facts. Obamacare, for example, is much smaller than, say, the Medicare program or the Social Security program. It's not the largest entitlement in our nation's history. Obamacare has not raised costs of health care. It's actually lowered them. Healthcare spending has been falling. But look, we could go back and forth about that. I think the main thing is that people take very extreme views of this policy based on their approval or disapproval of the president. We saw it first in a Jimmy Kimmel segment where he asked people, do they like Affordable Care Act? They said yes. Like Obamacare, they said no. Basically, I think that's because there's been a lot of demagoguery and not a lot of focus of the facts around what this law is actually doing, which for most Americans is nothing. Okay, for 80% of Americans, the system was working fine and Obamacare leaves them alone. That includes Medicare. That includes employer-sponsored insurance. These people are largely left alone. What this law is trying to do is fix the system for the 20% of remaining Americans for whom it wasn't working.
All right, Jim. All right, Jim, I got to go to you on this one here right now because Jonathan has made a lot of points here as well to what the critics always say. Answer them back.
Well, the misinformation is widespread, perhaps by Jonathan and his troops. Quite frankly, from the get-go, the irony of ironies is that the Democrats for years have accused the Republicans of going to destroying Medicare. The irony of irony is the Democrats have taken over $700 billion out of Medicare, and we seniors won't forget that. That's the bottom line, pure and simple.
Isn't there? Wait a minute. He makes a good point, doesn't he, Jonathan, about the senior side of this, correct?
The Affordable Care Act absolutely had to be financed. President Obama was clear it would not raise the deficit, and half of the financing came from reduced spending on Medicare. But let's talk about what that is. Most of that is an ending of overpayment to insurers that privately insure elders under the Medicare Advantage program. And in fact, Medicare Advantage enrollment has not fallen. It's gone up. since the Affordable Care Act. So that's had no costs except for lower profits for insurers. The rest is a slowing in the growth, the rapid growth of reimbursement to hospitals, which once again, there's no evidence that it's harming care in any way. Yes, Medicare is being reduced, but with no evidence it's affecting seniors in any way.
All right, Jim, I get to you. He says it's not affecting seniors in any way. There's the two words. I want to make sure you said it right. Any way.
I'm sorry, but we were told we could keep our doctors, not. We were told premiums would go down, not. We were told we could keep our plans, not. And speaking of Medicare Advantage, most seniors were satisfied with that. They're being forced off it now, and guess who's going to benefit? The AARP, with their supplemental plans, making millions and millions of dollars on the backs of senior citizens. That's why I call them the Association Against Retired Persons. They're looking out for their financial bottom line, not for the elderly like myself.
And Jonathan, what about all the younger people in America right now? And because we are now hearing, and it's been documented many times, that there are a number of premiums that are going to go up next year, no matter what anybody says, no matter what they're told. And I can tell you frankly, I know a lot of people who are under the age of 25 who are looking at what they're going to pay, and they look at me and go, this isn't the way it was supposed to be. Why is my insurance going up so high?
Well, we have to remember that in this market, premiums went up by about 10% a year before the Affordable Care Act. The best estimates from the data we have so far is that premiums will go up around 7% this
Well, but that's an average. 7% is an average.
That's an average. And just as before the Affordable Care Act, sometimes they go up by 50%, sometimes they go down by 20%. Likewise, on in the current data we've seen increases as large as 20%. We've seen decreases as large as 20%. These numbers were variable before, they're variable after. Look, the Affordable Care Act cannot be held up against perfection. The Affordable Care Act does not fix everything that's wrong with U.S. health care. Critics would like to hold it up against that standard to criticize it. What you have to ask is, did it make it better? The answer is yes. Premium increases are smaller. The variation in premiums, the huge jumps, are smaller. It's not fixed everything, but it's moving us in the right direction.
Why is it then, and again, I know, and we have to point this out here as well, Jim, or Jonathan rather, you were involved in actually writing the law, and you have said many times before, I know more about this law than any other economist, quote unquote. Then why are there so many surprises?
Because it's unbelievably complicated. Look, we're talking about.
But if we knew everything that was there, and again, I don't mean to interrupt, but I just want to ask this because you and I haven't had a chance to talk about this. Understanding it's very complicated, why weren't all these things taken into effect before the law was actually implemented so it would work properly right from the very first moment?
Well, but let's be fair. We say all what things, except for the website glitch, which was fixed within about 6 weeks at the national level, it has worked properly right from the very first moment. Now, is the law perfect? No. Partly that's because it's incredibly complicated. Partly that is really, quite frankly, due to the fact that there were a lot of things which were supposed to be worked out in conference which couldn't be because the Senate was no longer Democratic after Scott Brown got elected. So it was really not a very final version of the law that became enacted. But the bottom line is, except for the website glitches for about 6 weeks, which were fixed by mid-November, the law has worked as it was written.
All right, Jim, I heard you chuckle in the background. Go ahead.
Well, blame it on Scott Brown. I thought he was going to blame it on George Bush, who's been gone for about 6 years. Let me just ask this question. If does Obamacare cover perhaps selective amnesia, since all those Democrats who voted for it seem to have completely forgotten about it? I got to tell you, the bottom line is seniors will remember in November. And by heck, they vote in larger numbers than anybody else. And the Senate, quite frankly, is going to switch to the Republicans, all the way from Alaska to North Carolina and many Senate races in between because of the failure of Obamacare.
Jonathan, what does that say to you? And again, I've only got about a minute left here right now, but what does it say to you? Republicans take over, things are going to happen, and Obamacare will change.
What it says to me is the major difference between conservatives and liberals is conservatives say things like they're certain when they're not, and liberals allow the uncertainty in their statements. Look, we don't know what's going to happen with the Senate. Right now, it's about a 55% chance they'll swing to Republicans by the best estimates. But the bottom line is, I urge voters to look at the facts, not at the ideologues. The point is, seniors have not suffered in any way. Seniors should ask themselves, are they worse off, or is Fox News telling them they're worse off?
Not suffered in any way. I just want to make sure you point it, not suffered in any way. We can quote you on that.
Yep, you bet.
Okay, Jim, what do you think?
The big R, rationing. It's around the corner because of Obamacare. There's not only a doctor shortage on the horizon, there's a nursing shortage on the horizon. This is, quite frankly, one of the worst pieces of legislation I've ever seen passed in my more than 50 years in the nation's capital. I'm not saying the total thing. It'll be repealed. It'll be replaced with some good things. There are some good things in that bill. I hate to say that in 2,000 pages.
Okay, it's
but in
fair.
2,000 pages, you ought to be able to find one or two nuggets of goodness instead of all the bad things.
Gentlemen, we're going to come around and look at this again because, trust me, every time we have the two of you on or anybody on about this issue, we will always dig for the facts every single time. I promise you that. Jim Martin and Jonathan Gruber, thanks so much for being with us. We'll do it again.
My pleasure.
Thank you.
All right, gentlemen. By the way, something that I did want to point in here. According to the Los Angeles Times today, 10% of those who signed up for coverage on new federal marketplaces created by the law, they may lose it because of improper paperwork or because they can't prove of their citizenship. MidPoint continues right here.